Hello and welcome. My name is Vicky and I am one of the Eden educators. Today we will explore how Covid-19 and its recovery can have an effect on people's mental health. We will explore some of the common effects that recovering from COVID can have on our mind and discuss how some helpful tips and advice to give our patients can help. We will also touch upon diabetes distress and burnout, and there will also be some helpful resources which can be used for both people living with diabetes and healthcare professionals. So each individual will experience COVID recovery differently. Many people make a full recovery within 12 weeks, but some people unfortunately do not. For some people, symptoms can persist for longer than 12 weeks, and these may change over time and new symptoms may develop. You may have heard of the term long COVID, and this is an informal term that is commonly used to describe signs and symptoms that continue or develop after an acute infection of COVID. Now, depending on how long someone has had the ongoing symptoms for, it can be called one of two things. Ongoing symptomatic COVID, and this is where the symptoms continue for more than 4 weeks. But if symptoms last for longer than 12 weeks, it's often then called post-COVID syndrome. And this is where the ongoing symptoms continue for more than 12 weeks and cannot be explained by any other condition. COVID recovery does not just mean physical recovery. It also applies to how it might affect us mentally. And these are some of the effects that COVID can have on our mental health: fear and anxiety, low mood, frustration, poor memory and concentration. And these are all completely normal feelings after having been unwell with COVID. And it is important to recognise and make our patients aware of these symptoms and that they are normal. Fear and anxiety is the feeling of unease, worry or fear. And fear is part of our fight or flight response to danger. And some of the common symptoms are an increased heart rate, faster breathing, sweating, and butterflies in the stomach. People may have the expectation that any fear or anxiety that was present while someone was unwell with COVID will have gone now that they are recovering or recovered. However, this is not always the case. Having COVID and being unwell in hospital or even at home can be really frightening, and this can result in ongoing experiences of fear and anxiety. So what advice should we give? Well, firstly, reassurance that fear is normal is really important. If someone has been in hospital with COVID, they may well have learned an association between certain physical sensations, images, sounds, smells, and danger. And this means that if they then experience these certain memories or sensations, their fight or flight response may be triggered automatically. Now, over time, this response will gradually reduce, but it may take weeks or even months. And there are some things that can get in the way of this natural resetting of the fear response. So sometimes it's good to advise people to set a time for them to think about their worries, because we know that trying not to think about things that are concerning us often make them worse. So sometimes it's a good idea to suggest to schedule a particular time in the day to think about their worries. And if a worrying thought occurs during the day or night, ask them to note it down and to continue doing what they were doing, and then come back to it later where they can spend a little bit of time focusing on this. Also trying to keep busy with other things and trying to encourage people that when they feel particularly anxious, to try something to distract them. So it could be maybe going for a walk or calling a friend on the phone. Encouraging people to get back to normal activities, such as things around the house, maybe a little bit of gardening, pottering, or some DIY might be helpful. And these are things that people may have been avoiding because of health worries. Relaxation is also good to manage fear and anxiety, using things like visualization or mindfulness. And at the end of this session, there are some resources that you will be able to signpost your patients to. There is also the option to signpost your patients to local talking therapies. And the link on the slide here shows you where to direct your patients to, and people can actually search for local services using their postcode. So low mood is another issue that some people might experience after being unwell with COVID. And it's common to experience low mood after any type of illness. We know also that relatives are just as likely, if not more so, to experience low mood rather than the person affected by COVID. And this is irrespective of whether they had a long hospital stay or recovery at home. Low mood is often feeling sad or empty for much of the time. Someone might be more tearful than usual, losing interest in activities, difficulty making decisions, even day-to-day, simple decisions. Sometimes people start to take less care in their appearance, and there can also be thoughts of self-harm, and these are all common indicators of low mood. There are actually also physical effects associated with low mood too, such as moving or speaking more slowly, a decrease in appetite, or actually the opposite, an increase in appetite or overeating. Some people may experience low sex drive or libido, and many complain of disturbed sleep, either difficulty falling asleep or staying asleep or waking up very early. So again, what advice should we give if someone's experiencing low mood? So the first thing again is reassurance. Reassuring our patients that low mood is not a sign of weakness. And this is really important. For most people, low mood will improve on its own, particularly as people start to get back to doing the things they enjoy. If some of the things aren't going to be possible for a while or even at all, then trying to find alternatives will be important to help people feel a sense of achievement or feelings of accomplishment. Trying to advise a routine is always a really good idea. So often people with low mood can easily develop poor sleep patterns, such as staying up very late and sleeping for long periods during the day. So try and encourage your patients to maybe set an alarm to get up at the normal time and try and stick to their normal or usual routine as much as possible. It can also be really helpful to set achievable goals, and this can help people to make a daily plan of things that they would like to do and enjoy. And this helps to give them some structure and focus to their day. Talking to other people, even if you can't meet them physically, meeting up with friends and family is not always possible at the moment, but talking to others on the phone or via video call can improve our mood. It can also help to reduce the feelings of isolation. It can often be a welcome distraction. Trying to eat well and be physically active are both really important as well. We know that eating a well-balanced diet often makes us feel physically better too. And we know that physical exercise can also help with psychological well-being. It is important to remember, though, that if someone hasn't been active for a while or exercised recently, they should start off gently by walking or maybe just pottering around their home or garden, and they should keep this in line with their current physical limits and abilities. It's always a good idea to advise our patients not to drink too much alcohol, because when people are feeling low, people sometimes find they start drinking more to cope with or hide their negative emotions, or just to fill the time. However, we know that alcohol won't help to solve the problems and can make low mood worse. Again, there's the option there to signpost your patients to local talking therapies. And this is something that you can ask your patients to do themselves, or you can do on their behalf. So we can screen for depression by using certain validated tools. And here is the example of the PHQ-2 screening tool. It consists of 2 questions which are scored according to a number scale. And if someone scores them more than 3, then it's advised that you further evaluate them with the PHQ-9 screening tool. There are also some great resources on the NHS website for patients to access themselves, such as this, the NHS Depression and Anxiety Self-Assessment Quiz. But do be mindful that this self-assessment is not designed to replace speaking to a healthcare professional. So, memory and concentration. Most people who have had COVID will recover with no long-term impact on their memory and concentration. But some people will experience mild difficulties that don't last for long. But other people, those who have had severe illness, may find problems do last longer. And we know that people who have had some memory problems before becoming ill with COVID may find that they worsen afterwards before they start to get better. So why does COVID affect memory and thinking? Well, after any type of viral illness, fatigue is common, and this can affect our ability to concentrate. Some may feel that they don't have the mental energy needed to pay attention to things, even when something is really important. And poor concentration also makes it harder for us to remember information and instructions. Some people who have returned to work may find it difficult to concentrate on work tasks, especially those that are less interesting to them. And trying to concentrate can also feel really exhausting, which then leads to a vicious circle. So trying to get a good night's sleep is really important to help our memory and thinking. And I'm sure we've all been there personally when we've had a bad night's sleep and we find it a lot more difficult to concentrate on those tasks we have to do the following day. So trying to manage the attention and concentration problems, if someone's attention capacity is limited, it can be very helpful to reduce distractions. So when trying to do something demanding, it's best to advise to try and find a time and place that is quiet and ask not to be disturbed. Sometimes calming music without lyrics may also be helpful. And for those with memory problems, it can be really helpful to use an external aid like a phone or a tablet or a good old-fashioned pen and paper. And these can be used to make lists, to-do lists, reminders, and to tick things off once they are done. Cameras on phones can also be really useful to capture any visual information that you need to remember. A regular routine is really important, and this can help reduce the demands on our brains, making it easier to get through the day. And planning ahead makes it less likely for us to forget things that need to be done on a daily or a weekly basis. And taking regular breaks, again, really important. It allows us to regain concentration, refocus, and reflect on what we are doing or what we have done. So I shall just talk a little bit now about diabetes distress and burnout. So diabetes distress isn't the same as depression. Diabetes distress is when a person feels frustrated, defeated, or overwhelmed by their diabetes. These feelings can come and go, and often someone will not have these feelings about other parts of their life. It's just related to their diabetes. However, diabetes distress can turn into depression if someone has had these feelings for a while and they aren't going away. Diabetes distress is actually really common, and it's a completely natural reaction to looking after diabetes all day, every day, without ever having a day off. It doesn't matter what type of diabetes someone has. Anyone can feel diabetes distress, and a lot of people feel it more than once in their diabetes journey. According to Diabetes UK, 1 in 4 people with type 1 diabetes and 1 in 5 people with type 2 diabetes experience high levels of diabetes distress. It is slightly more common for people who take insulin, and the signs and symptoms may vary, but some of the common ones are feeling angry about diabetes and frustrated about the demands of managing it, worrying about not taking enough care of themselves from a diabetes point of view, but not feeling motivated to change, avoiding going to appointments or monitoring blood glucose levels, and making unhealthy food choices on a regular basis. And often people feel alone and isolated. Feeling burnout because of diabetes can be different for everyone, but it can mean that someone living with diabetes may stop taking care of themselves and their diabetes. For some people, this means skipping insulin doses or not taking tablets, and some describe it as hitting a wall or giving up. Having diabetes distress for a long stretch of time can lead to burnout. So that's why it's important to be aware of the signs and symptoms and know when to signpost your patients to the right kind of support. So there are some really good resources that you can signpost your patients to. We have the Your COVID Recovery NHS website. And this helps people who have had COVID to understand what has happened to them and what they might expect as part of their recovery. Much of the information discussed during this session today is based on the information available on this website. And it's a really valuable resource to signpost your patients to, but also really helpful for healthcare professionals and their learning as well. The NHS website also has lots of great resources, such as videos, tools and guides, along with information on how to find a local psychological therapy service, many of which can be accessed via a self-referral process. There is also a really good Diabetes Psychology Matters website, and this is a website run by diabetes psychologists. There are infographics and resources that are free to download, including tips on relaxation, how to get to sleep during anxious times, and managing worry about COVID and a health condition. And finally, us, the EASN team, have a range of resources specifically related to diabetes and COVID-19 recovery, which you can also utilise as healthcare professionals, and these will be available on our website. And that brings us to the end of this short session. I hope you found it useful, and thank you for listening.